The federal government is set to reduce PBS script prices, making medicines cheaper for all Australians. The Health Minister is speaking right now, as a matter of fact, so let's just take this for a moment before we go to Ruben.
There have been about 34 million of those scripts delivered since that policy took effect, saving people money but also saving them trips to the pharmacy where that might not be necessary. We froze the price of medicines this year. Prices for medicines for pensioners and concession card holders won't increase for the rest of this decade. 5 years of price relief for vulnerable patients. But also we froze the price for 12 months for general patients this year. Today I'm announcing that this week we will introduce legislation to deliver the fifth wave of Labor's cheaper medicines policies. Again, something we worked so hard with Trent and his colleagues at the Guild on. We will slash the price of the maximum co-payment for general patients to just $25 from the 1st of January. That is where it was back in 2004. There aren't many health services or health products today that you'll buy for the same price you could get them at 2004. Coincidentally, the year that Trent and Emma became registered pharmacists, they can talk about that experience. I'm a lot older than them. I was well into my career by then. But $25 is the price it was in 2004. Without the measures that we have delivered on cheaper medicines, the co-payment next year for general patients would be more than $50. Twice what it will be because of our measures. This again will save about 5 million Australian patients $200 million a year and will just add to the measures that we have put in place that have already saved Australian patients more than $1.5 billion a year. As I said, cheaper medicines aren't just good for the hip pocket, they're good for health because they mean more Australian patients are able to fill the scripts that their health practitioners have said are important for their health. I'll hand over now to Trent.
All right, we'll leave it there and go to Ruben Spargo in Canberra. Ruben, Labor will bring the bill to Parliament this week, as Mark Butler said.
Yeah, and cheaper medicines aren't just good for the hip pocket, they're good for health, according to the Health Minister. Pete, I can share that the government at this stage plans to table the bill on Wednesday. As we've heard, it will reduce the price of scripts on the PBS to $25. They're currently $31.60. It's forecast the change will save Australians $200 million annually. The proposed price would apply to the new generation ADHD medication, insulin for diabetics, the injection for osteoporosis, other things like the new generation blood thinners for somebody that's had a stroke, and much, much more. The $7.70 script price for pension and concession card holders would be unchanged. Here was Anthony Albanese on the government's agenda in the new Parliament.
Whether it be protecting penalty rates, this week cheaper medicines, the reduction in HECS debt, are all about delivering on our commitments to make a difference to people's cost of living and to fulfil the promises that we've took to the election.
From memory, we might have encouraged the government to bring that legislation on before the election rather than waiting until after the election. We'll take it through our party room processes, but this is something that the opposition, the coalition, have always been in favour of.
Pete, the $25 per script price would start in the new year.
All right, Ruben, thank you.